Hi, this is Dr. Teresa, Healthy Choice Family Chiropractic, and this webinar is all about your curves. And yes, I'm talking about your spinal curves. So these curves in your spine are so important, but unfortunately, we're seeing more and more people no longer having these curves, and we're seeing that occurring at an earlier and earlier age. So tonight we are going to talk all about these curves, what they mean, what you're supposed to have, and why they are so vitally important. So when we look at your spine from the front, we should see it make one straight line. But when we look at you from the side, it should have four natural curves. So what we're looking for is we're looking for a nice forward curve in the neck or a cervical curve, a backwards curve in our middle back, which is our thoracic curve, forward curve again in our low back or our lumbar curve, and a backwards curve again once we get towards our buttocks or like by our tailbone. So those are the curves that we are looking for and that we should see. You can see them right on that right side of your screen. Now, how do we get these curves? Well, when we're born, our spine is actually in a C shape, and it has to be just to allow for baby to be able to, come out of the womb as easily as possible. So we're born with our spine being in a C shape, and then through natural development and meeting our milestones, then we start to develop these curves that we need throughout our life, and overall, then we need to work towards maintaining them. So this is one of the reasons why tummy time and crawling is so vitally important for our spinal development. So basically when we're having a tummy time, so when kids start to learn to hold their head up, or babies do, that starts to create that normal curve that we should see in our neck. Then when they go towards crawling and balancing on their hands and knees, that allows that curve in our lower back to form. And then when they are walking or becoming fully upright, that's what then allows us to work towards maintaining that normal S-shaped curve that we should see. Now, why do we want these curves? Well, these curves are really important for many reasons. First and foremost, proper curvature of the spine gives it flexibility and creates support. So the offsetting curves of each section creates a spring-like structure, enabling the spine to act as a natural shock absorber. If it were straight up and down, the spine would take on tremendous wear and tear from constant vibration and shock, and that could create fractures or even worse. Also, if we've lost that curve, that causes abnormal pulling of our muscle. So basically cause like our muscles in our neck or other areas of our spine to just feel constantly tight or ropey or knotty. Also, it will cause us to put more pressure on weaker areas of the spine. So it can cause us, like in our neck, the strongest portion of our bone is the back side of the bones. Then as our spine starts to, if we lose our curve, starts to go straight or forward, puts more pressure on the front where it's weaker. Also, it can even, because of that neural pulling, it can also add tension to our spinal cord, which that can create multiple health issues. So just a few of the things or symptoms that can associate with loss of our cervical curve. What it can cause: neck pain, headaches, chronic neck tension, pain, tingling, or weakness in our arms or legs, loss of range of motion. Also can increase the risk of degeneration and arthritis and bone spurs, so essentially arthritis in our spine. Also, a decrease in the cervical curve has been related to a disruption of the essential nutrients and oxygen supplies to the brain, which can lead to hypertension, confusion, lethargy, pain, dizziness, nausea, and possible insomnia. So it can cause a multitude of health issues. Now, how do we know if we've lost the curves in our spine? Well, the only way to really know that is by taking an x-ray. I mean, we can look at someone's posture and we can kind of see if we suspect if they've lost any of their curves. But really the best way to see that is by taking a spinal x-ray. We take digital x-rays in our office, and it is the best way to be able to see that, and that is just one of the many reasons that we take x-rays in our office. So what is causing all this curve loss? Well, really we know there's three big reasons that it's causing us to lose our curves at an exponential rate. One of these being that maybe we never formed the curves to begin with. I mean, like we said, that's why tummy time and crawling is so important. Kids need these for proper spinal and neurological development. So we want to make sure those are milestones that are not being skipped. Also, big injuries like a car accident or another whiplash injury to your neck can also contribute towards loss or reversal of curve. But the biggest one by far that we are seeing is posture. And that's also the reason why we're seeing this military neck or tech neck, which is a lot of times what's referred to when we do lose that normal curve in our neck. That's why we're seeing it in kids earlier and earlier. With all this looking down that we're doing on a regular basis, it's putting our neck in the opposite position of how it actually should be. And as a result, it's causing us to lose our curves and really preventing them from even being able to fully develop. And that's why we're seeing this happening more and more. And we're seeing this on kids on a daily basis. So now proper posture can affect more than just the curve in our neck. It can also cause our heads to start creeping more and more forward. And it can also even cause a rounding or increasing the curvature in our middle back, which can give that hunchback look. That's why we really need to focus on our curves overall so we can work on reversing that, especially because, like I said, we're seeing this happening more and more and earlier. So I know we've been focusing a lot, or I've been referring to a lot more of the curve in our neck than any other area of our spine. Yes, all of our curves are important, but we've just seen through research that the curve in our neck is the most important curve in our spine. And that's the one that if we've lost, we really want to focus on regaining and then work on maintaining. So you may be thinking, oh no, I know that I've lost the curve in my neck and now I'm doomed. But you can get those curves back. So when we see curve loss in our office, we work with individuals with three main ways to work on restoring and getting back those curves. First, we perform chiropractic adjustments to help get more movement of the vertebrae in our neck. Also, we do this so that we can work on changing how your nerves are working, functioning. We know that your nerves are so vitally important to how your whole body works and functions. So we definitely need those functioning well just at the start. Okay. Also, we do give individuals stretches to do. When we're talking about curve loss, we really want to focus on some stretching of the muscles on the front of our neck, just because if those are tighter, that's going to pull our head more forward, and that's going to put us in more of the opposite position of where we want our curve to be. Also, we do want to work on strengthening those muscles between our shoulders because that can just make it easier to be able to sit up and be in that proper upright posture. Also, we do recommend an at-home cervical traction unit called a dinner roll. That can be seen in the lowest picture on the right. That dinner roll is made up of a highly dense foam, and it's shaped in a way so that when you lay on it on your back, it'll push into your neck and will help towards regaining that curve. And with regaining that curve, that can help take pressure off the nerves, slow down arthritis and degenerative process, and help an individual's symptoms disappear quicker. Also can help just overall take stress off your spine, which then that can help someone hold their adjustments longer and help to overall improve their neurological function, which is always our goal as chiropractors. So if you're watching this webinar and you're interested in working on correcting your curve, we do have a special going on until August 8th and that's when you purchase the dinner roll, you get a free resistance band. Those are the bands that we utilize in the exercise of bringing your head back. So that would be both for just $50. And now if you're also like listening to this webinar and you're wondering even if you've lost any of your cervical curve and if that could be contributing towards your spinal and neck problems, we currently also do have a new patient special until August 8th. That would consist of a consultation to discuss your health concerns, examination for spine, neurological scans, and any necessary spinal x-rays for just $39. If you'd like to take advantage of either one of these specials, you can give us a call at 616-426-8500 or email us at info@healthychoicefamilychiropractic.com. Hopefully you learned a couple things just on this quick intro to curves and all about why your curves are important and how to regain them if you lost them. Thank you for joining.